Breast reduction surgery can be life-changing, but there are a lot of myths out there related to this procedure. So let's get the facts straight. Hello, I'm Dr. Arjun Handa, plastic surgeon at Handa Aesthetics and Plastics. So the first myth, which is the most common one associated with breast reduction surgery, is that this procedure is mostly done for aesthetic or cosmetic purposes. While that may be true to a certain extent, but the majority of patients who come looking for this procedure get it done because of functional issues like shoulder pain, back pain, neck pain, and maceration in the skin folds. So this is the most common reason for which this procedure is done rather than cosmetic or aesthetic purposes, although that also is an important aspect of the procedure. Myth number 2, breast reduction interferes with breastfeeding. 90% of patients who get this procedure done go on to breastfeed normally. 10% may have some problem in the form of decreased production or no production of milk. But there is no study indicating that it is directly related to the procedure, because in modern ways of doing this procedure, we preserve all the connections between the nipple and the gland. Myth number 3, that there is an extensive recovery period associated with the procedure. Most of my patients who get this procedure done go home about 3 to 4 hours later. They come back on 4th operative day to get their dressings changed and to have the inspection of their wounds. They are back to work in 3 or 4 days, and the rest of the recovery can occur while they are doing their work, which usually takes about 7 to 10 days. There is some swelling which goes away in a month, but in effect, you're back to work in 3 or 4 days and you don't have to worry about the healing process as such. And neither is it very painful because the patient is going home the same day. The final myth is that the breast reduction procedure is reserved for older females and older patients. Well, that demographic certainly makes a huge chunk of the patients that come looking for this procedure, but most of the patients also belong to the teenage group and also early 20s. And these patients are usually suffering from back pain, chronic neck pain, social anxiety and embarrassment due to the abnormal size of the breast. So this procedure is not only for the older generation, but for the younger individuals as well. So now you know the 4 myths that are associated with this procedure. And if you're looking for this procedure, please feel free to contact us. Thank you.